The Now Foundation Women's Health Award is given each year in honor of longtime Now member and benefactor Victoria J. Mastrobuono of New Jersey, whose generous bequest to Now Foundation is a legacy that continues to promote women's equality long after Ms. Mastrobuono's passing. Dr. Nancy Klimas, a professor of medicine, psychology, and microbiology and immunology at the University of Miami's Miller School of Medicine, has worked on behalf of women and women's health care for more than a quarter century. Dr. Klimas is a feminist whose contributions extend well beyond the purely scientific. As a medical student, she formed a group called the Medical Students for the ERA. She founded and was the first president of the University of Miami Medical Women, and later she went on to serve as the faculty advisor to this same group. To this day, the university faculty and administration look to the University of Miami Medical Women as the voice of women students at the medical school. And Dr. Klimas also helped to create a group called the Gauze Ceiling. It's an organization of local women doctors that works to advance women in medicine in South Florida. Throughout her professional life, Dr. Klimas has worked tirelessly, nationally and internationally, to advance our understanding of diseases that predominantly affect women, and to improve women's access to health care. Dr. Klimas is known here and around the world for her cutting-edge research into complex diseases that involve immunologic, endocrinologic, and neurological dysfunctions. And I said it all without stumbling. Thank you. That was not easy. Dr. Klimas' current research is on chronic fatigue syndrome and Gulf War syndrome. Understanding how genes regulate these systems, how computer modeling and chemical interventions can be used to help reset a patient's system to create a new balance. Dr. Klimas is equally well known for her delivery of competent and compassionate care of all patients. She does not separate herself from the emotional well-being of her patients and their families. She makes herself available to chronic fatigue syndrome support groups across the U.S., as well as in Canada, Europe, South America, New Zealand, and Australia to share information, latest research, and therapies. Dr. Klimas' patients come from all over the world, and frequently they wait up to 6 months for an appointment. This fact alone has driven her to train more physicians to research and effectively treat these poorly understood diseases. Dr. Klimas is the recipient of numerous awards, including the 2010 Mae Brunson Award for Achievement on Behalf of Women, the 2011 University of Miami Distinguished Alumni Award, in 2006, she received an honorary degree from the University of Catalonia in Barcelona, Spain. And the International Association for Chronic Fatigue Syndrome actually created an award and named it for her, the Nancy Klimas Research Excellence Award, which is given annually to honor the most outstanding research achievement. So Dr. Klimas, Nancy, it is my greatest pleasure and honor to present you with the Now Foundation's Victoria J. Mastrobuono Award for Women's Health.
So thank you for this amazing honor, and Terry, thank you for your very kind words. It's very sweet. I want to say I've received dozens of letters of congratulations anticipating this award because it went out on the blog world in chronic fatigue syndrome land. And when you listen to the tenor of the letters, they're proud of me, and I appreciate that. But they're really, what it's really saying is that you've validated, you've given a voice to an illness that has been very very misunderstood, disrespected, and when the patients hear that someone's getting a national award for this, it gives them a sense of self-worth and self-esteem that sometimes is taken away from them. So I do appreciate this on behalf of the patients with both chronic fatigue syndrome and Gulf War illness. And I want to take just a moment, because some of you may not know about these illnesses and just why it is a feminist issue to be here talking about chronic fatigue syndrome and Gulf War illness. First, Gulf War illness, if I might, just for a moment. Even though fewer women went to the Gulf War, on a percent basis, far more women came back ill. So they were more at risk for this illness when they came back. And you may not know, but 1/3 of the Gulf War veterans came back with Gulf War illness. It's a vast number. We sent 800,000 people to the Gulf War, and 1/3 of them came back ill, and they are still ill. So that's a rather stunning number. Chronic fatigue syndrome has the same kind of misunderstood numbers. Again, it's predominantly a woman's illness, maybe 85% female. Very true of almost every immunologic condition, 85% female or so. So there are maybe 200,000 people in this country that carry that diagnosis, but there are 1 million women and men that have that diagnosis. That means 80% don't even know they have this illness, because people so misunderstand, and there's been so little education around this illness that doctors don't know it when they see it. They certainly don't know what to do about it. And these poor patients who are truly suffering, this is a disabling condition. It's not just a little bit sick. It's not just a little tired. It's disabling fatigue, disabling illness. These people cannot find health care. And more misunderstanding. There was some yuppie flu kinds of descriptions of it when it first came out, you might recall. But it's far more predominant in ethnic minorities and lower socioeconomic class. So it's misunderstood and then misunderstood and misunderstood. When I started this years and years ago, the thing that got me into it, I was sitting in my office, I had a woman come in. She said, I am just terribly ill, and she proceeded to describe this illness with fatigue and pain and sound like a virus, a very bad virus, just went on and on and on and on. And she'd been to 18 doctors. She came with a record like this. And she said, I've had doctors tell me to get my hair dyed. I've had doctors tell me to take this antidepressant and that antidepressant. I've had doctors tell me to divorce my husband, that he's my problem. And so on and so forth. And these are the kinds of advice that doctors have been telling. She says, I just want to know, is there something wrong with me? And the only thing people have not looked at yet is my immune system. So that's what I am. I'm an immunologist. So would you please, doctor, just look at my immune system? So I did it, pulled out all the stops, I looked at everything I knew how to look at, and I came back and I said, I have very bad news. And she said, oh my, what's up? I said, your immune system's got a real issue here. I said, the cells that kill viruses aren't working. And she said, she burst into tears. And I thought, oh my God, ruined her life. They were happy tears. She said, oh my God, doctor, you've told me there's something wrong with me. Now I can get on with this. Now I can try to solve this. So they were happy tears. And I can't tell you how many hundreds of times I've replayed that. Hundreds and hundreds and hundreds of times, as recently as yesterday. And that's how this really is. And it just goes on and on and on like that. So here are these women with this illness. Now let's throw on some data. There's a roughly $3 million a year of NIH money out there for this illness. There's $18 million for male pattern baldness. Okay? We are not exactly making headway here. And this is a downward track. It's really, really sad to say. Well, $3 million, I got a $3 million grant once for HIV that was just my grant. One grant, $3 million. I would have represented the entire world of research on this disease. And that's not uncommon. We have an $18 million HIV grant in our group right now. $18 million for one group to do one study. And we are dividing up this $3 million pie in tiny little slices and trying to answer this problem. It's a really big deal. We had one really big thing happen this year because of advocacy, because people complained to their congresspeople and effectively used advocacy. They got it listed as one of the diseases that the congressionally mandated research office at the DOD has to fund. That's a huge deal, I cannot tell you, because they have $18 million in this pot that has to be divided among a bunch of diseases, but at least there's more money there, and it's congressionally mandated. Advocates got more money in the chronic fatigue syndrome pot this year. It was a very effective tool. So in some ways, I've been watching these women with this terrible illness develop their voice, their political voice. And it's been just wonderful to see. And when you see it in someone who's so physically impaired, when there's so little to give, and that they find the well and then they give, that is really a remarkable thing. So it's really a great pleasure for me to see their advocacy grow. And for me, it's also a great pleasure to, when my own activism and professional life come together and merge together into this field. It's been a very fulfilling thing to be able to use my medical research skills in a way that was truly feminist. So it's very exciting for me. So I want to say that a couple other things, just a couple other things. One is that when I see a person with this kind of illness that's so very ill, have the strength and courage just to persist, to go in day by day and continue, to have the hope that something's coming down the line that's going to help them, that they're living on their hope. That's a lot of courage. And I think we can all take a lesson from that, that hope is an extraordinary, powerful tool, emotion, and core thing that we have to live with. And that helps us continue to live even in the face of tremendous adversity. Maybe a lesson here sometimes with our own politics, because we all see that 2 steps forward, 1 step back thing going on and on and on politically, and you have to keep your hope that that's what gives us courage. And people, there's an honor in that, a real honor that helps us, I think, carry on the fight and keep things going. So I hope that you feel that in your own soul. And when you're talking about yourself, think about the lesson these women have taught you. They fight for a better world themselves, all the while advocating in the world as an advocate, but also advocating in their own personal little world, the health sphere, their healthcare provider, as their own advocate, their own voice, that they've had to educate themselves to educate their provider to be able to get the care they need from their provider. That's advocacy. That's important. That's loving yourself enough to take care of yourself. And those of you in this, I will say, I know a lot of you. I wouldn't say you're all that good about taking care of yourselves all the time. So if you would take that advocacy for yourself into your own world, yes, I know, and some mirror image stuff there too. And we'll all do this together to take good care of yourselves in this, because we need you. We need you to be healthy, able, strong, committed, and empowered to keep on doing the fight that you're doing. So thank you very much for this honor, and I do appreciate it.